Hey there, I'm Juyles. I'm a BHT Supervisor here in Durham, North Carolina, and I got an Ask Emily question that I'm really excited to talk with you about today. So the question that I got is, why can it be hard to navigate alcohol or alcohol use while we're in eating disorder recovery? And I think the biggest thing to talk about before we even talk about how hard it is and why it's hard is that it's really common. Up to 50% of folks who have eating disorders struggle in some capacity with substance use or alcohol use. And so I think just kind of setting that ground to begin talking about how difficult it is can help us maybe feel a little more normal in the conversation. When we are engaging in our eating disorder and in our eating disorder behaviors, a lot of times we're looking for something specific. We're looking to not feel something. We're looking to feel something. Maybe our eating disorder is keeping us safe for a time. Maybe our eating disorder is helping us regain control. And it feels really good at times to engage in those behaviors. Our dopamine shoots up. We feel really good until the crash happens. And then we go to treatment, and then we start recovery. And then we leave treatment, or we're really deep in recovery, and we're like, man, I really need to feel those things again. But you don't want to go back to your eating disorder behaviors, and so maybe you choose something else. And oftentimes, substances or alcohol can be that thing that you choose, because it can help us avoid the hard parts of recovery, right? It can act as something to give us the feelings that we've been using our eating disorder behaviors for without engaging in our eating disorder. It can feel like a loophole. And then it creates a cycle, and then it doesn't feel like a loophole anymore. We're actually really tired, and we feel like there's something wrong with us. And we feel like we're never gonna have a normal relationship with alcohol or a normal social relationship. And then it spirals. And so I think something to leave with you today is that the work that you do in your recovery is transferable outside of the rigid confines of treatment. I know it can be really hard that we're having these thoughts when we go home and there's nobody there offering you a DBT skill. But making sure that we're able to really engage with our coping skills while we're in treatment and to create that strong foundation when we leave can really be helpful. Alcohol and substances are really hard to navigate, especially whenever we also have an eating disorder, but you're not alone, and there are resources out there for you. Thanks.